Okay, on this chest X-ray, then we clearly see like a more than blunting of the costophrenic angle. Here we actually see like menisci.
I don't see any
meniscuses. So if we take a look at this chest X-ray on the left-hand side, we can see like that layering out of fluid on the basal aspect, and then layering on the right-hand side. So this is actually fluid accumulation within the pleural space.
Pleural effusion.
Pleural effusion, hence the term, right? So the other thing actually that might be important to keep in mind is how much volume is there. So as a general rule, on the PA view in adults, we take a look at, when we see blunting, just that kind of filling up that apex portion of that clear space inferiorly of the lungs. It takes about 250, 300 cc's of fluid to cause that blunting.
Almost a can of soda.
Right, exactly, just about that volume. On the lateral view, it takes a lot less because we can see the costophrenic angle a lot more clear on that one. So that takes about 75 cc's of fluid to distinguish that. But let's contrast this. So this is fluid in the pleural space. So let's contrast this with fluid like in the parenchymal area. So this is an example of an air Branca Gram. So air Branca Gram, here, let me just show you what we're talking about. So here's the bronchi, right? So the airway tubes, and then that we can see here. So the reason why we get that outlined here is because we have either some fluid accumulation,
like
cells,
from a pneumonia,
like a pneumonia,
case,
right? So some kind of fluid that's around those regions. So that when we have like it's almost like a sponge.
Yeah, it highlights the air fluid interface.
Exactly. So here we get this air Branca Gram. So this tells you that the fluid is in the parenchyma, not in the pleural space. We can also take a look at this chest X-ray, which shows you cephalization of the pulmonary vasculature. So if we take a look up here, now these vessels, just to be clear, these vessels are here normally, but we just see prominence of these in this particular circumstance because of changes in the Starling forces or changes of pressures across the pulmonary circuit. So again, this is consistent with someone with a heart failure.
Yeah. The pump is not pumping hard enough, backs up into the pulmonary vasculature, and you get cephalization because it's going to the head even though they're upright.
Right. So we can see that as an index that there's something clearly wrong with that individual. The other thing that we see too is accumulation of fluid in the septa in the lung.
Interstitial
so we talk about like these curly B lines. So if we take a look off in the periphery, in fact,
subtle.
it's a little bit hard to see, but we see like almost like these
horizontal lines at the periphery.
Right.
Yeah.
So fluid accumulation in the interstitial tissue. So those are the curly B lines that we can make out. I could never figure out curly A lines and curly C lines, so I'm not even going to talk about those.
Curly B lines, they're good enough.
Right. So by the characteristics of curly B lines, though, just so that we all know, where we take a look at these, they're like these horizontal occurring accumulations of fluid in the septa. They're like 1 to 2 centimeters, and we see them on the periphery. So that's where we identify curly B lines.
And that can be found in like pulmonary edema, but
exactly.
should be clearly distinguished from the pleural effusion and the meniscus sign, which is in the costophrenic angles and layers up as you get more and more and more.
Right, exactly.